2016 meeting of Carson City Board of Health. May I have roll call, please?
Member Aboud?
Here.
Member Bonkowski?
Here.
Member Bagwell?
Here.
Member Shirk?
Here.
Member Furlong?
Here.
Vice Chair Kroll?
Here and healthy.
Good. And Chairperson Pintar?
Here and, yeah, never mind.
Quorum is present.
Thank you. I'd like to open with any public comment that is appropriate or possibly inappropriate. I don't know. Oh, good, the boys showed up. Thank you. I will ask for a motion for approval of the minutes of November 19th, which I'm sure you have all studied judiciously.
Move to approve the minutes of the Carson City Board of Health for November 19th, 2015 as presented.
Motion for approval. Any discussion? All in favor?
Aye.
Those opposed? Motion carries. Thank you. I will give a brief health officer report. Just to say our flu season has begun. Luckily, it's been a pretty mild one so far. Typically, flu travels east to west, and we are starting to see. Nevada has had 4 deaths, unfortunately. They've all been in Southern California, or Southern Nevada. So there's still time to get your flu shot. Our peak is not expected until the end of February or March. And a lot of people think by March the flu season's over, but for us it's not. I gave you, and there's a copy in the back, a copy of America's Health Rankings that were just released last week. Nevada, you'll probably recall that there are county health rankings that are released at the end of the year, and then at the first of the year they release the state rankings. Nevada is 38th. Yay, we're not the bottom! So we're solidly lower middle class, is what this is telling us. It mentions our strengths. It says low prevalence of smoking. I can't say that it's a low prevalence of smoking, but we are having significant decreases in the prevalence of smoking, and our community statistics bear that out. The state does have a lower infant mortality rate than is typical and a lower rate of preventable hospitalizations. Of particular interest to me are a couple of things that affect health. And I think as a board, we're all aware of these, but the low rate of high school graduation is a determinant of health. And unfortunately, our state does not have a very good rate of high school graduation, which has a negative effect. We also have the lowest in the country rate of public health funding, which is kind of sad. Our state does not fund public health as well as any other state in the country. And we have a fairly high percentage of the uninsured. So anyway, there's good news and there's bad news, but we're not last, which is always good news in Nevada. I hate to tell you that. I did want to remind you all that we are all members of the National Association of Local Boards of Health, or NALBO, which provides very useful information as far as the governance of health departments and health efforts in a county or municipality. You should all be on their email list, and there's a quarterly newsletter. But the good news is that for the first time, somebody from Nevada is actually on their national board. Dr. John Novak, who's a dentist and a member of the Washoe County Board of Health, has been appointed as a national representative, which is wonderful because public health issues in the West are pretty dramatically different from those of the Midwest or the East, and that's where most of the National Association of Boards of Health has focused. So I'm hoping that Dr. Novak will be able to turn some attention to issues that are unique to the West. What else? Oh, I wanted to say that immunization rates are improving, and our state statistic bears that out, as does our county statistic. I think that I would like to give some shout outs to improved access at the health department. The hours for immunizations have increased, and also give some thanks to some of the public-private partnerships like the school-based health center, which is a partnership between the school district and Nevada Health Centers to increase access to immunizations as well. And I think last but not least, as far as my report is, our wet weather is wonderful, but it makes some of us think about mosquito-borne illnesses. So we are gearing up. We, the royal we, meaning Dustin Booth, who's our epidemiologist, is gearing up to be a little bit more aggressive about getting rid of mosquitoes, since we will hopefully have some more places for them to live this year. All right. And I'll chat a little bit later, but right now, I guess, let's see, you have to give me a motion for approval with feedback and direction. Doesn't say, but we can ask for public comment. Public comment's always invited. Okay, now you can.
I move to accept the health officer's report.
Second.
Thank you. Motion and second, all in favor?
Aye.
Those opposed? Thank you. All right, now I am going to go down to Adriana's desk because we're going to talk about our sexual assault response team. I thought it was time that you met the members of the team, and I'm going to chat a little bit about what each one of them does. I'm coming down. Sheriff, you got out of it. They showed up. All right, look, here they all are. Stand up, yes. Universal acclaim for the members of Carson City Sexual Assault Response Team. Yay! Now, let me tell you a little bit about what, yeah, thank you. Adriana needs to stand up because, okay, let's start. We're going to start with the boys. They put up with me for calling them the boys, but they do. Our detectives, Detective Acosta and Detective Spiegel, are the primary, yeah, Acosta, Spiegel, right? Yeah, okay. They are the primary point of contact. Victims typically present to the sheriff's office or to the hospital when a sexual assault has occurred. And one of these gentlemen is always called. They do a wonderful job. They've gone some extensive training. They deal very professionally, very soulfully isn't the right word, but very nicely. It's a horrible crime to have to report. It's a horrible crime to have to investigate, but they do a great job, and they are an integral part of the SART team. Next, they call Tracy and Lisa. Tracy has a last name that I'm not going to say. Lisa is Director of Advocates to End Domestic Violence. One of the biggest programs under Advocates to End Domestic Violence is called the SARA program, Sexual Assault Response Advocacy. So SARA is easier to remember. But what these women do are they volunteer and they accompany every member of who reports a sexual assault. One of the SARA volunteers goes with every woman or man who reports a sexual assault through the entire process, from talking with the detectives to an exam if it's necessary, to filing for whatever victim's assistance is available, helping them through the legal process, through the court process. They'll even go to court with them if necessary. They are a big reason why our sexual assault response team is as good as you're going to find anywhere. So I thank you for that. Now, the next thing that happens is that our detectives make a report and they submit it to Adriana, and they also talk to Ms. Frankie, who is the victim's advocate for the district attorney's office. Frankie helps them with all of the court-related issues. She contacts them privately to make sure that they are understanding what their rights and responsibilities as a victim are. And our associate DA make sure that we have all of our ducks in a row so that we can make successful prosecutions. And I'm very proud to report that we have a pretty good rate, a pretty incredible rate of positive prosecutions. Victims also, it's not a crime that you report and you get over real easy. And so one of the essential services that's offered is follow-up support, and that's where human services comes in. Mary Jane and Vicki both work for Human Services. They help victims with getting money for, what's it called? The counseling for the Victims Assistance Program. They direct them to clinic services if they need follow-up. And a big, where's Deb? Deb, please come stand up this way. The young lady in the orange, oh, and there's Dr. Hess too, sneaking in. About 1 out of 5 of our victims who report a sexual assault need to have an exam. And we try to do that exam as quickly as we can. Typically, within the first few hours of report, to up to about 72 hours. Exams can be done later than that. Doing an exam is a very meticulous process and it requires a lot of training. And we're very lucky to have Dr. Hess as our medical director and Deb Robinson in the orange as our primary examiner. These are tough exams to have to do, as you can imagine. These are typically women who have just suffered one of the most severe traumas, both emotionally and perhaps physically, of their life. So we're very grateful to have a very good medical team to support us in this effort. So that's a little bit about what the SART team does. I wanted you to meet them. I wanted you to thank them. And we can talk a little bit about individual statistics if you want to. So any questions?
Yes, Susan, could you actually introduce Kitty so she can talk about the facility a little bit?
And I did forget, I'm sorry, Karen, you were supposed to come down here with us. Karen has been a member of our team for the past year and has been very useful as a liaison and helping us get things done. I also would like to introduce Kitty McKay. Sorry, Kitty. Kitty is the director of Carson Hospital Foundation, and what the hospital has been able to arrange for us is a wonderful exam facility in the specialty hospital, the old hospital location, and that we've had the unfortunate need to use it, but we have been lucky enough to have a very nice local facility, fully equipped, courtesy of the hospital. So I do want to thank everybody there. She's not on the team. Explain.
I'll get a picture.
Oh, all right. What, now? Comb your hair. Comb your hair.
Ladies, gentlemen, please, if you.
Is this off or Kathy? I'm going to break it if I don't. Here. I also want to give a lot of credit to our city manager, who has been very proactive in getting some funding. The sexual assault response team has basically operated on whatever they could grab by hook and by crook within their individual departments. And so I want to thank Nick for allocating some money so that we can do a better job. Thank you.
Thank you, ma'am. For the record, there was no crook involved in this. It was all. Shepherd's crook. That's the derivation of it.
What was it? Oh, I know. I was going to tell you a couple of numbers, just out of interest. Sexual assault accompaniments are a pretty good measure of how many sexual assault reports we have in our community. And in 2000, back me up here, Tracy. In 2013, we had 59 accompaniments. 2014, we had 67. 2015, we had 88. Now, of those, about, as I mentioned, about 1 in 4 report in time or have to need an exam. So we have about 25 exams a year. Now, everybody says, oh, that's awful, that's an increased number. I say, hey, that's not bad. And the reason being is that we know these assaults have been occurring. I don't think the total number of assaults is really up. I think members of the community are more cognizant of the services, more willing to report, and know that it's going to get prosecuted. And so to me, I'd like to put a positive spin on that, really.
And Susan, I'd like to agree with that. And through the hospital, a comfortable location for that uncomfortable situation has been allowed. So that's awesome.
So anyway, good news, sort of. You're not out of a job, Trace. Okay. Thank you all. So if there are any other questions for the sexual assault response team? All right. Well, then, without further ado, we will go to the director's report. Ms. Nikki?
Good afternoon, Nikki Aker, Director, Carson City Health and Human Services. And so I'm going to first turn it over to Mary Jane Ostrom, who's the Division Manager for Human Services, and she's going to talk about a new process, the coordinated entry.
Good afternoon. This is Mary Jane Ostrander with Human Services. So the coordinated entry, I just kind of wanted to walk you through this briefly. We can go into more detail when we present it as our QI project for the community. But basically, coordinated entry is being required by HUD for anybody receiving HUD funds. And that's to try to, the goal is to house the most vulnerable people first and to be able to identify those. So we have become the coordinated entry agency for Carson City area. You may have heard the term centralized intake. They're changing the name like weekly. This week it's coordinated entry. So basically what'll happen is anybody presenting themselves as a homeless person, either to the Sheriff's Department, another agency, or anywhere, they're gonna direct that person to come see us. And what we'll do is it's called a VISPDAT. It's a vulnerability index service prioritization decision assistance tool, a VISPDAT. It's, it sounds like you're sneezing, but so what that assessment tool does is that it identifies the vulnerability of that individual. It goes through the history of housing and homelessness, the risks. Risks include questions about ER visits, law enforcement interaction, and crisis services. And then socialization and daily function is also scored, as well as wellness. So once that person is scored, what we would do is refer them to any housing options that are available. Of course, none of us have enough money. So what we're doing right now is we're putting them on a waiting list. And when we do open up where we can house somebody, we will look at the highest scores first, not necessarily the date they came in, but who is the most vulnerable. And those are the people that we will attempt to find again and get housed. Then any other referrals also prior to them getting housed will also be made. Some of the referring agencies will be, of course, Nevada Rural Housing Authority, the Fish Shelter, the Advocate Shelter, any housing programs we have. And since we do have the emergency shelter in Carson City, we do see a lot of outside our city coming into the shelter. So if we have somebody from Lyon County, we're going to refer to the Lyon County housing programs. And a big tool in all this is our database. It's called HMIS. They're changing the name to CMIS, but anyway. And it's a national database. So we're one of the first agencies in rural Nevada to be entering the VISPADAT in this database. And so what that's going to do is if that homeless person ends up in another county, they're going to be able to see our VISPADAT and see what the score was. It's really important that they not take that same assessment over and over and over, because the answers are going to change. Gee, I didn't score to get an apartment that time, so let me change the answers. So with that will be in there. And this database will allow us to actually do the referral to Lyon County, where Lyon County will get a red flag that they have a referral, and be able to tap in, see the assessment, and start screening for the housing programs. That's in a perfect world, you know. All the other agents, or we're all learning that system and how that's all going to work and everything now. But it's exciting. It's exciting. So,
Well, Mary Jane, you may want to refresh us. Some of the background data is that, you know, it used to be first come, first served, and that did not bear out very well long-term, especially for health implications, mental health implications. And so the federal government has been switching to the, I guess you call it a needs-based vulnerability index is what they're calling it now, which has been a more successful model as far as decreasing chronic homelessness, and that really is a big goal.
yes, yeah. And when we're putting them on our waiting list, we're trying to identify, you know, what services are you using? Where are you at? Do you have a cell number? Do you have somebody else that knows where we could find you? So that we can show that we're making every effort to track that person down once we do have availability. We've been playing around with the system since December 1st, and what I mean by is we kind of started it. We weren't really the coordinated entry agency yet, but then we just became it. But so we were just trying to play around with all the tools and everything. And we are now officially the coordinated entry. But since then, we have done 24 assessments. And we have gotten 6 people housed through Nevada Rural Housing Authority. And they've gotten their vouchers. A couple of them are still looking for apartments. And then we have one other person that's been housed, and we're just now pulling somebody for an apartment in one of our programs. So that's good. And it was really neat to be able to use that tool to, you know, figure out, okay, who are we going to go with? So that's a little bit about the coordinated entry. Again, we're doing it as a QI project also, so we'll have a lot more details on how those referrals are working and things like that. So it's neat. We're excited about it. Okay. The other thing we have coming up, speaking of homeless, we have our point in time count next week, next Thursday. We're doing an event this year at the community center gym from 10 o'clock to 2 o'clock. We've invited resources to come and provide anything that they can for any of the homeless to come in and get some dry sleeping bags, blankets, gloves, socks, anything that they're bringing. We also see it as a good opportunity to do the VISPADAT. So we're going to be doing some of those assessments there, as well as the point in time requires an interview be conducted. I think we're going to get kind of a different group, which is kind of exciting. I think we're going to see a lot of the people that are living in motels come to the gym, and we haven't really had an opportunity to interview them before, because they haven't really, they won't go down to where we're doing the interviews in the past and stuff. But from what I'm hearing, we're gonna be able to hopefully get a lot more interviews, and probably from a different dynamic, so.
Mary Jane, can I just ask a question? I noticed in Reno, they're doing a point-in-time count, but it's for youth, 18 to 25. Do we delineate at all in terms of how we're doing what we're doing, or not?
No.
Okay.
No, and I don't know why they're doing that specifically. Reno kind of does it a little different. They do a whole week-long event where the point in time is really a point in time. It's a snapshot on this day who was homeless. I suspect that there's more agencies up in Reno that get specific funding for the youth, and that is a concern of HUD's, that's a direction that they're looking at. Now, when we do the assessments and the count, we're counting how old they are, so we can see how many youth or how many under 25 there are.
And are you able to put them with housing? It's a little bit different circumstance. How do you do that in terms of if you're trying to find a place for them to live?
Really, we would do it as anybody else. You know, we do have some limited resources in Carson City as far as our fair market rent right now for a household of one is, I believe, $536, which is pretty low. And so we're limited there. But Ron Wood also works a lot with that group, just coming out of foster care and stuff like that. So we would definitely tie into whatever resources they have to be able to support that youth as well.
I want to point out that the point-in-time count is not just people who show up at the community center, but volunteers go out, look for folks who might be homeless. Other volunteers go to the hotels and motels in the community, and the Carson City School District McKinney-Vento program, their coordinator is polled as to the number of homeless kids. Those could be as old as 18 or 19. And so the event here is part of it, but Mary Jane and her folks really, and the other agencies in the county really do a lot of effort, a pretty extensive effort to try and identify the homeless in our community and get them hooked up with the resources that we do have.
And if I can just add, so this is a national event. It takes place across the country around the same period of time. And then also we will be providing flu vaccinations for individuals that come to the community center.
We're also going to be doing some HIV testing. We have Nevada Legal Services that'll be there. The Dream Center, which does a lot of hygiene kits and stuff, will be there. Fish will be there. Salvation Army will be there. Yeah, so as many as we can. And you guys are welcome to come by. You can sit down and do a vice for that.
Mary Jane, just off the, I think I'm done, there we go. Do we retain the records long-term about who is homeless? Unfortunately, we lose about one a year to the elements and usually find them in the springtime. And I remind that we have one still open that we have not been able to identify. Do we retain the records or the ability to positively identify some of these homeless long-term?
For the point in time count, we don't take names. A lot of times, if it's a straight count, sometimes you're not even talking to the individual. It could be a safety factor, so you're just doing an observation. During the interviews, we don't take the names, and we don't record those. However, with this database and doing the vice stats, we will have long-term, and we'll actually be able to track on where they've ended up, because everybody's going into that database for housing.
What was the usage, or is the usage, of the Fuji Park homeless shelter for the weather issues?
Fish had reported 6 to 8 people each of the nights.
Just like to know, yeah.
I'll be happy to send that out to everybody if you'd like to know the nightly count, because,
We haven't had to turn anybody away though, right?
no.
No.
And we have extra space available?
Yeah.
And it's the fish bus that picks them
Or
up?
shelter bus.
The shelter bus? Okay, thanks.
Okay, any other questions on our homeless? I also wanted to present our WIC program, our Women, Infants, and Children. Our numbers have dropped in this last year. They have also dropped statewide. There's a lot of, even Carson City has populated places that have a lot of difficulty getting to our office, or Ron Wood, who also does WIC. And so we're really looking at being able to do some satellites to get those numbers up. We do believe there's a lot of people that qualify for it, that need it, that aren't able to get to it. So we're going to be doing a lot more outreach and everything to hopefully get those numbers up and get people that service. I'd also like to introduce our new WIC CPA, soon-to-be CPA. And Heather, you want to come on? Oh, no.
Would you like me to say my name?
This is Heather Kabatka. Almost. Okay.
Come on up, Heather. It's up here.
And she's going to be working in both our Douglas County Clinic and our Carson City Clinic, and also doing a lot of outreach. We're excited to have her. So if you want to just tell a little bit about yourself, that would be great.
A little bit about myself.
Yeah.
Can you press the mic? Okay, so my name is Heather Kahopka. I've lived in the Gardnerville area for 12 years. I worked for WIC previously in Southern California in a very large clinic, and hoping to help increase the numbers considerably. And I'm very excited to be here. So.
Thank you, Heather. Yeah, we're looking forward to Heather's outreach efforts for both counties. WIC is, as you probably know, a nutritional support program for women, infants, children. The income levels are higher than those of the federal poverty guidelines, so many folks may not recognize that they could qualify for, it's an ATM card that they can use in the grocery store to buy nutritious groceries. And so part of Heather's job is going to be, spreading the word. The other word I would like to spread, if there's any agency that has a vehicle that we could commandeer and turn into WIC on wheels, that's the big idea right now. Mary Jane talked about having satellite offices, but one of the and I'm going to give Mary Jane credit for the idea, but one of the things we're thinking is that if we can go to those neighborhoods and say, tell everybody, okay, we're going to be here once a month, then that will help increase the availability of these services. Because it's not a hard application, it's not a lot of paperwork to do, but there is, it's a federal program, there's paperwork. So, but we know that there are families out there that could use the service. So anyway, if you find an extra truck, let her know.
Yeah, just to tap on that, you have, if you have a two-parent family, a lot of times they might only have one vehicle, and maybe one of them's working all day, so the other one can't get to all these appointments and everything. So, that's another dynamic that's very common with our families that we're serving. And a van would be nice instead of a truck.
So a van, we're looking for a van, or we're looking for a vehicle that transports people, not transports things, right?
No,
Primarily.
it would act as the office.
Okay.
So we would go to a neighborhood and
We might have an old jack bus. I'll have to check into that.
Yeah, that's what we were looking at.
MJ, you're going to look good behind the wheel.
Okay. All right, any other questions on WIC? Thank you. And then our workforce development, I just wanted to announce we have our next job fair on February 26th from 2 o'clock to 4:30. There was some question on, do we still need the job fairs? And so this one, it'll kind of answer those questions. Our employers said, yes, 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 we still want one. At our last one, we saw the numbers drop of job seekers, but that's probably not a bad thing. This year, or now, also, our job seekers that we're working with are a little lower functioning. They're the harder to place job seekers. So we're really having to revamp and change around some of our training and things like that, which is okay. That's why we're here, to do that. So so you may see some changes. We're going to also focus our weekly workforce classes before the job fair toward what do you do at a job fair and how do you dress, and we're going to try our best. So we also did a presentation to Vitamin Research employees earlier this month. Vitamin Research is closing their doors here in Carson City. I believe they're moving to Florida. So we reached out to them and wanted to get some resources to their employees. My understanding is they may lose their health insurance as soon as the doors are closed there. So we wanted to get them some resources on the clinic, Sierra Health Center, prescription assistant programs, things like that to keep them going, as well as introduce them to our workforce program. We were able, and Vitamin Research had their own job fair, so they invited us to be there. We were able to talk to 49 of their employees that will be out of work by the end of the month. So that was good, and we hope to do more things like that. Not that we want more places closing, but, and then in our workforce, we also do one-on-one assistance as needed. So.
Thank you, Mary Jane.
Thanks.
Good job on getting her to do most of your report, Nick.
I keep her going. Okay, so we'll go on to clinical services. So this is a graph of the encounters that we had November through December of 2015. So unduplicated patients, that number was 1,192. And then the number of encounters or services was 1,690. So you can see there what our immunizations were, and again, that could be that an individual was coming in, they may receive more than one vaccine or vaccination, so that's counted as that they are receiving 2 vaccinations for one person. The TB testing, again, as I've reported in the past, that there's a 2-step process to that. It's placing it and reading it. And so that is the placement and the reading, because they have to take place on different days. So, and our sexually transmitted disease testing and treatment, 101 was the encounters. Our well child exams and WIC hemoglobins, that was 50. And then our pre-employment drug screens was 16. And again, that's for employees coming in to be employed by the city. Mm-hmm. We don't do it for other organizations. It's
not
city
a
only.
publicly offered service, is the.
Okay, also in clinical services, so according to the CDC, this is a chart about the chlamydia rates within our community, and chlamydia is the most prevalent STD or sexually transmitted disease, and it occurs at a rate of almost 89%. And 80% of the chlamydia cases are diagnosed in individuals that are 24 years or younger. So what chlamydia can result in is what they call pelvic inflammatory disease, ectopic pregnancy, and infertility. So you see that that's a sexually transmitted disease that's very important to catch and treat. You don't want to let it progress because it can cause some pretty substantial problems in the future. And as you can see from the chart, our chlamydia rates are rising. And you may ask, why is that happening? And I ask that same question. So we've got a work group, our STD pregnancy prevention work group, that's looking at all of this. And they're working on getting information from the laboratories in the area about the total number of tests that are being processed so that we can actually have a definite numerator and denominator to determine an exact rate. Although, this is very preliminary data at this point, that may suggest that our community is testing more people. And that may be why we're seeing an increase in the cases. And so you ask, is the increase bad? When you look at it a different way, it may be also good that we're finding and treating these individuals that have gone untreated in the past. So, and at the clinic.
I was just to say, a parenthetical note, though, is that teen pregnancies are down in our community as well as across the country. So what Nikki is saying about the chlamydia is kind of like I was saying about the sexual assaults. The numbers are up, but we don't think that it represents an increase in the amount of incident, just an increased identification of what's been there.
And then Carson City Health and Human Services Clinical Service, we play a vital role in the STD screening in our community. 45% of all positive chlamydia cases have been reported by 25 providers in the area, and we actually, so 45% of all the cases that have been reported have come out of the Carson City office. So we do play that vital role. So through our epidemiology program, I wanted to report we did have a GI illness outbreak in December. And so it kept that program pretty busy. So on December 21st, we were notified that there were two laboratory confirmed cases of salmonella. So there were interviews that were conducted, and of those interviews, we were able to establish that there was a link to a social gathering, and it had occurred 2 days prior to them reporting ill. So on December 23rd, we were notified of an additional laboratory confirmed case, which attended the same social gathering. So working with the leadership at the social gathering that this occurred at, we were able to deploy a foodborne illness questionnaire to see if we could figure out which food item could have caused the illness and if there were additional individuals that were ill. We received 45 questionnaires back from the individuals, and a total of 16 individuals had symptoms that met a case definition. So based on the analysis of the questionnaires that we received, there was no specific food item that caused the illness. Then staff interviewed individuals who were involved in the food preparation for the social gathering. And based on those interviews, there was a possibility that improper cooking, cooling, and reheating of the food items occurred. There was also a possibility of cross-contamination from one food item to the next. And salmonella is a common bacteria found in uncooked meats, such as poultry items. And based on the type of items served at the social gathering and the interviews with these individuals who prepared the food items, the turkey or cross-contamination from the turkey to another food item was most likely the cause of the illness. So the end result was 16 people were ill and 2 of them were hospitalized. So you can kind of see that there's a lot that goes into any foodborne illness incident. There was a lot of interviewing and a lot of research to find out exactly what the source was.
Well, and I think a positive outcome is that Dustin and his crowd conduct a lot of education This, particular one wasn't a registered food establishment, but we all eat food that we cook at home or we go to people's homes or whatever. And so helping the community at large understand what the risks are, I think was a positive outcome for this type of incident.
Okay, continuing on with environmental health. So they are working on looking at some program standards, and these are designed to help food regulatory programs enhance their services that they provide to the public. And when applied in an intended manner, the program standards should, number one, they should identify the areas where an agency may have the biggest impact on food, retail food safety. Now, some of these, there's 9 of these standards, and one standard is the regulatory foundation. So that is, how is our code at Carson City, how does that compare to the federal food code? Another standard is the trained regulatory staff. So, how is our staff trained? Are they trained on the federal food code, and what does that training all involve? The third standard is the inspection program, which is based on particular principles that pertain to the food code. And the fourth standard is the uniform inspection program. Fifth code is the foodborne illness response. So that's talking about what is that response if there is a foodborne illness, and just as I spoke previously about that foodborne illness that happened. Standard number 6 is compliance and enforcement. So that's a lot of it. That's our inspectors going out and going for the restaurant inspections. Number 7 standard is the industry and community relations. So how do our inspectors, what kind of relations do they have in the community and in the industry itself? Standard number 8 is program resources. What resources are available to supplement our program? And number 9 is program assessment. So what they're doing right now, they're completing a self-assessment, which they are wanting to have that completed by March 2016. And then they're going to submit their paperwork to the FDA in April of 2016. So, talking about all these different standards, you can see how that does protect the community. It gives a good relationship with the restaurant owners and the community out there. And I've listed here on the slide some different advantages that the standards do provide. And this is a process that they're going through that is much like our accreditation process. So, any questions?
No, but I think Karen and I were at a cross-jurisdictional training meeting yesterday, I think it was. You weren't there. You were elsewhere.
I was in a grant site visit.
Okay. But the message that, from Douglas County standpoint, they are saving to date, they're saving $60,000 a year, which is a big deal. I mean, that program has probably a cost of $110,000 to $150,000, and they're saving $60,000 over what they would have been paying had not we done cross-jurisdictional work with them. So,
What the mayor is referring to is a couple of years ago, we started, basically, Carson City, Douglas County are consolidated services in doing restaurant inspections and health inspections in general. Is that right?
Right.
So the service that's being offered is cost savings all around, I believe.
All around, yeah.
So that program, it's being basically funded by the revenue that's coming in from the restaurant owners.
We knew you were
That was kind of important that I was there. That's where I need like a clone. Okay, so next I'm going to talk about public health preparedness. And in November and December, so they finalized the public health jurisdictional risk assessment for Carson City and Douglas County. And where that's standing right now, so they have sent that off to the state for analysis, and then the state will give a report back to us. They worked on many aspects of the 15 community and 8 healthcare system capabilities, but there are several other elements to address that they'll focus on as they are in the mid-year in budget period 4 and are looking for activities for budget period 5. So some of our strong points are community resilience, public information and warning, medical countermeasures, epidemiology, and volunteer management. And what they identified as gaps or areas to address in their next budget period, which is budget period 5, is community recovery, medical surge and crisis standards of care, which they're currently working on this, and it's in a collaboration with us and all the other subgrantees and the state that are working on these different activities, and it's a 2-year project. And another gap or area to address is the non-pharmaceutical interventions. So it's looking at the legal issues such as isolation and quarantine. And so you can see here they participate in the development of the regional medical surge plan, like I just talked about in the risk assessment. In the health department itself, there were 6 additional staff that were trained on the department operations center standard operating procedures. So that's looking at our incident command system, which the sheriff and fire are very familiar with, but we also operate under that ICS system, so it's getting everybody trained to that. You've heard in the past about the school-located vaccination program and what goes into it after the fact of giving the immunizations. So they completed the data entry into the statewide immunization registry, which is WebIZ. Many of you may have heard about WebIZ. It's the statewide registry, like I said, and any individual or healthcare provider, and even now, individuals can go into this registry and find out what immunizations have been given for themselves or their child. So they put in 5,000 school and community flu vaccines into this registry. And they're finalizing the billing contracts with United Healthcare and Cigna. And it's been a 2-year process with United Healthcare to get public health registered as a provider. And there's still a little bit of issues with that, but they've been working on that.
Did we participate in the RAM event?
Yes, we did. And
are you going to talk about that?
I reported on that at the last Board of Health.
There were, I'm trying to remember, a couple of hundred of flu vaccines that were given that our staff gave there at the RAM event. Mm-hmm. The other thing I was going to mention is that all the numbers aren't in, all the billing's not out and all the money's not in, but it looks like the school-located vaccine program, much to our thrill, is definitely a self-sustaining program as far as revenues. Is that a fair thing to say, Angela? Yeah. 463, thank you. And 300 people received other vaccines, like the Pneumovax or varicella, at the RAM event. But again, to kind of go on to what Nikki had just said, it's always reassuring when a public health program supports itself, and the school-located vaccine program seems to do that.
Okay, so also under the Public Health Preparedness Division, they have worked on developing a marketing plan for the entire health department, and we're very excited to have this because it gives us a plan on how we move forward with marketing different events. What's the national events happening around that time? When is, National AIDS Day? We can focus on those events and market appropriately. instead of just kind of taking it as each week or month comes along. We've got a definite plan, and in that, we're also looking at the advertising dollars and getting smart about it and capturing our articles that go in the weekly paper and planning those out ahead. So this will give us definite direction on how we move forward.
They want to know what ICD-10 is. It's an evil plot.
I saw
to-
ICD-10 is,
I'm going to say it from my perspective. Every medical service and every medical diagnosis that you have has its own unique identifying numbers. And so in order for a medical provider to get reimbursed by a company, you have to identify it down to, as Ruthie would say, down to the ant's whisker. And so there was a process, I can't remember what the ICD stands for, something diagnosis. Anyway, the 10th edition was just brought in, and it's a huge book, so it's difficult for non-medical providers to get through it, and that, I think enough said that they've been able to do that, so skip that slide.
skip it.
Yeah, that's
So, I mean, it drills down to exactly, is it right, is it left? It drills even further. And so why I have this on this slide, so we, basically Sandy Wortgrow in the office, she was instrumental in notifying Medicaid that they had incorrect ICD-10 billing. And as a result of that, it resulted in thousands of denials to not only us, but other providers within the state of Nevada. And so now Medicaid is working on that problem that's within their system. So, okay, moving on to our chronic disease prevention and health promotion. And through the adolescent health education programs, they've completed their review of the abstinence curriculum, the abstinence-only curriculum, and they also worked on CHIP, Community Issues H&I, and I know you guys are going to ask what H&I is.
No, we're not.
Well, I'm going to tell you.
know.
I am going to tell you anyway. So, community.
Used to be called harassment interdiction.
Yes.
I remembered that.
That's
didn't I?
pretty much what they are.
Okay, so community issue H is teenage pregnancy, and community issue I is sexually transmitted diseases. So, and then the staff are busy working with Story County staff to implement more sessions for their 5th and 10th graders. And as you remember from a past Board of Health meeting, we've gotten into their school district to provide this education, something that we would like to get into other school districts to do. And it's difficult to get in there. And then staff are also researching about hosting sessions that are open to the community, maybe during the Carson City School District spring break at our facility. And so when I was talking before about the chlamydia rates and the education that maybe needed to go out to individuals, this is through this program that some of that education can go out. And our tobacco program, there's a lot going on with that, as you can see. So on November 19th, they did the one-day stand against tobacco at Western Nevada College, and it was a great success for the first-time event. They had 3 tables in 3 different buildings. They had some tobacco products that were turned in, and in return, they got gift cards. And then they had over 100 surveys on the day of the event regarding, is the WNC students and faculty ready for a tobacco-free campus in the future? So they're also, Sandy's been working with Carson Tahoe on their electronic discharge instructions on smoking cessation. They've created some customized instruction with the information about the Nevada Tobacco Quit Line. They're seeing increased use by providers of these customized instructions. But one thing that they found out was that the software vendors, meaning the software vendors of the EMR systems.
Electronic medical records.
Sorry, it sometimes just rolls off the tip of my tongue. But they found that they're not always providing evidence-based practice for cessation within their program. So now there's going to be a task force that that Sandy's on with the state to work on electronic discharge instructions for smoking cessation throughout the state. So, and hospitals and doctors, a lot of them have different electronic medical records, so there's some problems with these electronic records talking with each other and that, but this is very exciting that we are on this task force and that this was discovered. Sandy's also been working with Carson Medical Group on smoking cessation policy for the practice to follow. It's, and what that is if they have a patient that needs smoking cessation information, that they will refer them to the quit line and give them the evidence-based information about smoking cessation. And this is the first type of policy within the state of this nature. They've also completed a survey on multi-housing units, the tenants within those units at 2 complexes regarding smoke-free policies for those units. They're meeting with one complex, discuss moving forward with the policy to become a smoke-free complex. So, and then
Excuse me, Nikki.
Yep.
Do you, working with the trying to make complexes, smoke-free and all that, do you do that same, I guess, standard for the Carson City's buildings? Do we have a smoke-free?
We have a smoke-free policy.
It is, okay.
Yeah.
Thank you.
And through this tobacco program, I was able to be a partner with HR and work on that policy. So, and our Carson City youth, they've been active in placing cigarette disposal containers and cigarette litter signage in our local parks, and they partnered with Parks and Rec to do that. And they've also been active in increasing their presence in social media to send anti-tobacco messages out. And Sandy's also been working with, again, this ICD-10, which we explained a little bit. She's working on the cessation billing and what these new ICD codes, how to use them and get information to our providers so they understand what codes to use, because when we went from ICD-9 to ICD-10, like Dr. Pintar said, it was a whole big, there's so many more codes now than what there were in the past. So for just smoking cessation, we went from 1 code to 50 codes. So you can see how difficult it is. So she's working with providers to get those right codes put in so that they can get reimbursed appropriately.
Nikki, who's responsible for the teen ads that have been on TV against smoking? They're really well done. I just don't know who's spearheading that.
I haven't seen it myself, but I believe that's CDC. Yeah, CDC's doing a lot of messaging right now about smoking, and it's the state that will be paying for those ads within Nevada, but the messaging a lot of times will come from the CDC. Okay, a little bit about our public health accreditation. You guys are all very aware that our site visit is confirmed for February 9th and 10th, and a number of you have agreed to meet with our site visitors.
Can I pause you for a minute? Is that the end of your report? Because we have to approve it, if so.
No, I'm not done yet. I'm hurrying. Okay, so just kind of what's happening here. So our training for internal staff is continuing. We've got brief group trainings at bi-monthly all-staff meetings. So whenever we have an all-staff meeting, there's a little bit of training for all the staff. Right now, we've got what we're doing is weekly questions out to the staff, and if staff participate, it's a question about accreditation, and if they answer it correctly, then they get a little prize, and then at the end, all the questions will go into a drawing for a fire. Amazon Fire. So, and work is continuing on our upcoming community health needs assessments. So we're partnering with Carson Tahoe and Carson Valley Medical Center. This is just a list of our quality improvement projects. The only addition to this is that we have a front lobby safety and security project out there right now, and again, we're taking any Board of Health suggestions as they come up.
And what's meant to hear is that if you have any, if you get any concerns from the community about the services or anything else, then we want to hear about those so that we can look at them. Okay.
I do have one. So I had staff that went online to take the food handlers test, and it redirects you to an outside website to take that. So possibly putting a note so they know that it is actually another vendor or someone that you've contracted with to do that, because the first thing it asks you for is money instead of, so they're confused with that. So I think if on the front of the website you could write, this will redirect you to blah, 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 blah.
Thank you, that's very good feedback.
Yeah, they're like, this is false.
Nikki, how many languages is it in?
You know, right off the top of my head, I'm not sure exactly how many. There's a lot. In the past, we've only been able to do English and Spanish, and it has expanded a great deal. But I can get you a list of all the languages that it is in. Okay, and I just wanted to start, I wanted to give you a little bit of fiscal update and have this available to you as part of my report. I want to report that the HIV prevention grant, which began January 1st, 2016, we realized a 51% reduction, which was $26,879. And this reduction came to us on December 30th, and we had to have a new budget to them by December 31st. Fortunately, we were able to redirect a portion of the staff member's salary to another grant and then adjust some of the grant deliverables. Now, one thing that has happened since then, like I said, I had my grant site monitoring visit yesterday, and I may be able to build some of these activities into the Ryan White grant. Not 51% to realize as much as this reduction, but I can build some of those activities back in. And then in 2015, you know, all the grants that have been renewed have been flat funded, meaning that we haven't seen an increase. And most of them are flat funded and don't see an increase or decrease, but we definitely on most of them have seen maybe a small decrease or being flat funded. And what this means, so in clinical services, we've got revenue that comes in, so we can make up this difference on some of the revenue that comes in. But what we're also having to do is look at our operating expenses and shift some of the operating expenses into the salaries. And in all of our other programs, that's what's happening, is our operating budgets for these grants is getting smaller and smaller as our personnel expenses are increasing due to raises and that. So I just want you all to be aware that this is going on, and I'll keep you updated. And
I think it points out the vulnerabilities in public health, and I started the meeting by talking about how public health in Nevada is essentially not funded at all publicly, and we're seeing the direct results of that. So it's a point of interest, but also we have to decide how important public health is when it comes to public funding opportunities, not just grant funding as well.
And also, we need to talk with our legislatures about public health funding. I have conversations quite a bit with Clark County and Washoe County and the state about how our funding is going. We had a meeting with the chronic disease individuals from the state and the other health authorities last week, and we were very clear in saying that in chronic disease, our funding is very minimal. And, we're not the only one that sees that, so we're getting that information out there to individuals, it's to the state, we need to write better grants at the state level in order to bring this funding back in. We did work in the chronic disease area. We worked on a white paper for really showing what the funding picture is for the state of Nevada. And that concludes my report.
Well, you start talking about the next item, that's when I'm like, oh dear, I'll get in trouble. Adriana fusses at me if I take things out of order. Any further questions for Ms. Nikki? I'll entertain a motion for acceptance, and if there's any feedback you'd like to offer.
I move to accept the director's report with any feedback that there might be, seeing none, and direction given by the board to staff on CCHHS Activities Incorporated.
Second.
Motion and second has been made to accept the report. All in favor? Aye. Opposed? Thank you. Motion is passed. And we will leave the microphone on with Ms. Nikki. She's going to tell us, well, let's see. What are you going to do? Oh, this is our educational opportunity, so that we will all be better prepared for our site visit. I lied. It's actually Valerie Quape who is coming to the...
For the record, Valerie Quape, Carson City Health and Human Services, Public Health Educator and Accreditation Coordinator. Thank you for having me again, Madam Chair, members of the Board of Health. I promise I will try to make this as quick and painless as possible. Today we're going to be going over domain 12. As we've talked about before, there are 12 domains that we're expected to demonstrate competency within to the Public Health Accreditation Board. As also mentioned before, the first 10 of these domains directly align with the 10 essential services of public health. Those additional 2 domains look at our internal administration structure, such as what are our policies, our human resources policies, et cetera, our organizational chart. And then that last one talks about our communication with our governance. And so we're going to do a really brief overview of that 12th domain. We won't get into the nitty-gritty within this meeting. Within the briefings, we may get a little bit more into the details, but ultimately there will be a separate interview about that documentation that will be attended by Dr. Pintar and our director, Ms. Nikki Aker. So you won't have to worry about getting grilled on that. So the purpose of this specific training is just to give kind of a sample of what they were looking for us to document as far as our relationship between the 2 entities. There were 3 broad standards that we had to meet. Standard 12.1 was to maintain the current operational definitions and statements of the public health roles, responsibilities, and authorities. So what they really wanted to see here was what were the provisions of the actual mandated public health services to the community. So that would be our restaurant inspections, pool inspections, disease investigation, mandated disease reporting, and I believe that's it. So the documentation that we included there included NRS and NAC 439, 441, and 446, as well as Carson City Municipal Code, Chapter 9. With the next standard, 12.2, we were expected to provide information to the governing entity regarding public health and the official responsibilities of the health department and of the governing entity. So they wanted to see some communication as to what we were doing to address those mandated services, and then also that we were communicating with our governing entity as to what is expected of our governing entity. So some of the documentation that we included there included our director's reports, our annual reports, and the Board of Health orientation materials, so that when we do have new Board of Health members, we do an orientation within the Board of Health meetings. So we included that as well. Last but not least, we have Standard 12.3, which is to encourage the governing entity's engagement in the Public Health Department's overall obligations and responsibilities. Here, the key is that two-way communication and emerging issues. The documentation that we submitted to show that two-way communication included our move to include the Comprehensive Teen Pregnancy Prevention Grant application to address the elevated teen birth rates in the area. That was discussed at a previous Board of Health meeting. We also included involvement of a Board of Health member, Supervisor Karen Aboud, within the development of the Carson City Health and Human Services strategic plan. Additional documentation included the report from the CCHHS Resource Stewardship Advisory Board, which was really excellent for us to have, and then any other discussions regarding what services the Board of Health would like us to see. One of those would actually be the implementation of, I believe, the 2014 Community Health Flu Pod, and the discussions regarding that. All in all, the questions that they're going to have of you are going to be a little bit more broad than these kind of nitty-gritty documentation questions. And as the Board of Health, one of the things that you can kind of anticipate would be that they may ask you to set more context as to the political and financial climate of our community. Our site visitors come from very different areas. So one comes from the state of Washington, one comes from the state of Colorado, and then one is the director of the Nevada County Health Department. And each of those organizations have different funding and programmatic priorities, shall we say, than the state of Nevada does when it comes to public health. And additionally, two of our site visitors have specialties in chronic disease programming, so they may be expecting to see more obesity prevention programming, more physical activity programming, diabetes education programming within the health department. And although we would love to provide those kinds of services, that's not really within our scope of work and funding resources at this time. So that would be the kind of questions and kind of context that you may be asked to add within that meeting. It's only an hour, so hopefully it won't be too long and too terrible. Do you have any questions for me?
And let me clarify, so when she said that one of them is coming from Nevada County, that's in California?
So Valerie, are they going to be interested in anything cooperatively that the health department has been instrumental in, such as the cross-jurisdictional sharing that we've done with Douglas County, such as the SART program, which was a collective work of many within the health department and outside agencies? I mean, is any of that going to be of any interest to them at all?
Yes. Okay. They will want to hear about that sort of thing. One of kind of our heartbreaks within this accreditation process is the Public Health Accreditation Board is, shall we say, a little picky about what they see as accepted public health programming, and anything that has one-on-one patient care or client services to them is not public health because it's not working at the population level. So unfortunately, a lot of our clinical services documentation was not eligible for submission, as well as our human services documentation. We actually submitted work done by the SART team as documentation of partnerships. And it was wonderful documentation that we did have these partnerships, and unfortunately that was bounced back to us as being a human services service and thus not eligible for submission. So yes, so we'll go over that more a little bit in the briefings, but just kind of keep that in the back of your mind. As far as the jurisdictional sharing is concerned,
I think that we had, both she and I had alluded to earlier, is that public health has a somewhat different definition across the country. And that's what I'm saying. It's nice to have somebody from the West on the national board to give that perspective. And it's likely that we will encounter questions like that because folks from different parts of the country look at public health, where I think in a broader perspective, whereas we look at it at a pretty personal level, which I'm not opposed to, but just there's a difference.
That they didn't know about.
Ooh.
I mean, I could talk to them forever, and then they'd think I knew.
You can do
the
that without acronyms. What are we talking about?
Well, we do have an acronym list that that we're giving them as a part of the orientation packet, so just give us the acronyms ahead of time and we'll be good to go. Any other questions at all? Okay, I believe that there are still a couple of you that I need to make appointments for briefings before the meeting, so I will be harassing you in the next
Ever
couple
so
of days.
gently.
H&I fires, Mr. Mayor, H&I fires.
Any questions for Valerie? We're looking forward to these visits, but Valerie is being given sedatives to get through them. All right, that was for discussion only. And then our final item of business is a recap of some items that have come up previously. And you may have had private responses to these, but we wanted to make it a little bit more public. So Nikki, go ahead.
So, and this is, I'm going to begin doing this yearly at the beginning of the year, just recapping for the prior year. And to be very honest, I'm doing this so we've got documentation. So when you see me going through things and you guys are giving me feedback, I'm over here writing it down and we'll be capturing it. So one of the items was a link on the website to restaurant inspections. I just want to report that's currently in progress. It sounds really easy just to put a link right there on the website, but there's more to it, so that when the public goes out there on this link, that there's historical data. It's just not a snapshot of what's on Carson now or in the paper. We want to make that more interactive for the public, and so we're working on that.
Nikki, we actually talked about that yesterday. So are you going to go back 3 years? How are you going to do that? In terms of if people want to see kind of the history of an establishment in terms of their health inspections.
Dustin right now is researching all that, and so we'll have a more definite answer in the future on that. In response to Supervisor Bonkowski, we were in the past putting just a form letter in the liquor license packet, and he reached out to us and wanted just some more additional information of where that organization or facility is at as far as an inspection, and so we came up with a new letter that he approved of, and I think it's working right now. If there's additional changes that need to be made, we'll be responsive to that. And of course, all of you get questions from your constituents, and anytime you get that, you reach out to us and we will respond to you, and we've done that throughout the year. And also, any responses or questions you have during the Board of Health meetings, or questions I can't answer right at this time, we'll definitely get back to you, like Karen's today. So I wanted to put that on the list here. We did have a a request that someone found a website link that was broke. So thank you very much. We always appreciate that those happen. The links sometimes change, and we don't go through all the links every day or every week. We don't have time to do that. So as you come across those or your constituents come across them, please bring them to us and we can get them fixed pretty readily. And there has been out there a request for obesity and weight control program. And, like I explained about what the status of our chronic disease program, right now we would love to do something like that, but funding is a constraint on that.
And I think, Nikki, you can add diabetes education has been another ongoing request. But again, we haven't been able to find any funding sources.
Correct. So this is my short list for you, and it's just for your information and give you that feedback of what we hear what you're saying, and we'll respond appropriately.
Thank you. And is there any other public comment to come before the board? Any other items? All right. Motion to adjourn. Thank you very much. Goodbye.
I'd like to ask, before we get into the actual budget process, if we could have a report on the ice rink activities and the fair. We haven't seen any of the updates on that, so if we could have a report, I'd appreciate it.
I just want to mention on the city website, we have a monthly report from the community development, which I think is very beneficial. And if we could expand that to other departments within the city, I think that'd be beneficial to the board and to the community in general. Also on the city website, there's a link to It's Your City, which this is no longer being funded, nor is it being filmed. Unfortunately, I think it's a loss to the community. Maybe that could be brought back within the city parameters, I'm not sure. We have a new agenda package, and I think it's great now that I've finally read through it the one time. But I do think page numbers should be incorporated on the summary, so we know where an agenda item is in the packet. We should have page numbers here. No, there's no page numbers. The agenda here. So otherwise, you don't know where anything is in the packet. But we should have page numbers here on our summary. Does that make sense? And then the online version does not have the same page number in the backup material, so when a citizen calls you and refers to a page number, they're going to the page number within that agenda item, and it's not corresponding to our packet. So I think it's great. I think there'll be improvements made as we move forward with this, but I do like it. And I just want to say, I know this is John's last meeting, and I want to say thank you for a great job of reporting to the community as you've done for many, many meetings. So thank you.
Just wanted to note that I was approached by a citizen who wanted to look into raising money to dedicate one of the downtown benches to Deputy Howe. And so I floated that idea out there, and as of, 2 o'clock, right before the Board of Health convened, we were up to 15 individuals that had donated $100 each. So we have that bench done, and I would like to continue accepting donations from anybody that would like to be a part of this, and we can come up with ideas for other benches or donate it all towards his bench. So I just wanted to put that out there, that it literally took from 9 o'clock this morning until 2 o'clock, and we had 15 different people.
About the artwork at his bench.
Yeah. So anybody that wants to participate in this, either get a hold of myself or Ronnie Hanneman down at the chamber. She's aware of this, and either she can collect the money or you can send it to me and I'll get it down to her. So we've got the bench, and if we can do some art to it or something else to enhance the area where the bench is going to go, then that's what the money will go towards. So thank you to everybody that's been a part of that, and anybody else that wants to do that, please get a hold of us.
Anybody else? We ready to adjourn or take last concluding public comment? Anybody?
John, do you want to say anything?
Come on, John. I was telling him, he has a different look today than he usually does. Man,
You will be missed.
You'll be missed, man. I don't know how we're going to get along without the writing style that you have. You know, you make people think. You know, that's sometimes beneficial. So anyway, all right. There's no public comment. Are we ready to adjourn? Unless there's an objection, we'll adjourn, period. We'll see everybody at 6 o'clock tonight when we have the joint meeting.